Understanding pain relievers. Why it matters. Pain is a universal experience, a signal from our bodies that something isn't right. Whether it's a pounding headache, the dull ache of a sprained ankle, or the throbbing discomfort of a fever, we often turn to over-the-counter remedies for relief. Two of the most common medications found in medicine cabinets across the globe are Advil and Tylenol. While both are effective in alleviating pain and reducing fever, they work in different ways and have distinct pros and cons. Understanding these differences is crucial for several reasons. First, it empowers you to make informed decisions about managing your own health. Knowing how each medication works can help you choose the most appropriate option for your specific needs and minimize the risk of unwanted side effects. Furthermore, this knowledge is essential for protecting the health of your loved ones. Children and older adults often require different dosages or may be more susceptible to certain side effects. By understanding the nuances of these medications, you can play an active role in ensuring their safe and effective use. Finally, knowledge is power when it comes to your health. By understanding the science behind these common medications, you can engage in more meaningful conversations with your healthcare provider and advocate for the best possible care. In the following sections, we'll delve into the specifics of Advil and Tylenol, exploring their mechanisms of action, benefits, risks, and appropriate usage. Armed with this knowledge, you'll be better equipped to navigate the world of pain relievers and make informed decisions about your health and the well-being of those you care about. Advil versus Tylenol, how they work. Let's break down the science behind these two popular pain relievers. Advil, also known by its generic name ibuprofen, belongs to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. NSAIDs work by blocking the production of prostaglandins, hormone-like substances that contribute to pain, inflammation, and fever. By reducing prostaglandin levels, ibuprofen effectively tackles pain at its source. Tylenol, on the other hand, contains the active ingredient acetaminophen. Acetaminophen's exact mechanism of action is not fully understood, but it's believed to work primarily in the central nervous system, the brain and spinal cord. It's thought to inhibit the production of certain chemicals that transmit pain signals, thereby reducing our perception of pain and lowering fever. While both medications can alleviate pain and reduce fever, their distinct mechanisms of action result in different strengths and limitations. Ibuprofen's anti-inflammatory properties make it particularly effective for conditions like arthritis, sprains, and muscle strains, where inflammation is a key driver of pain. Acetaminophen, while not directly targeting inflammation, is generally considered gentler on the stomach and less likely to cause gastrointestinal side effects compared to ibuprofen. This makes it a suitable option for individuals with sensitive stomachs or those at risk of ulcers. Understanding these fundamental differences is key to selecting the right medication for your needs. In the next section, we'll explore in more detail the specific areas of the body targeted by each drug and the implications for pain relief. Targeting pain where they take action. To understand how Advil and Tylenol work, it's helpful to visualize where they exert their effects within the body. Ibuprofen, as an NSAID, primarily targets areas where inflammation is present. Imagine a sprained ankle, for example. The injured tissues release chemicals that trigger inflammation, leading to swelling, redness, heat, and pain. Ibuprofen steps in to block the production of these inflammatory chemicals, reducing swelling and easing pain at the source. This targeted action makes ibuprofen particularly effective for musculoskeletal injuries, menstrual cramps, and other conditions where inflammation is a primary factor. Tylenol, on the other hand, takes a more centralized approach. It works primarily in the brain and spinal cord, altering the way we perceive pain signals. Think of it like turning down the volume on a loud noise. The noise itself, the source of the pain, may still be present, but our perception of it is diminished. This makes acetaminophen a valuable tool for managing headaches, toothaches, and general aches and pains. While it may not directly address the underlying inflammation, its ability to dampen pain signals can provide significant relief. It's important to note that this is a simplified explanation and the exact mechanisms of action for both medications are complex and still being studied. However, understanding these basic principles can help you make more informed choices about which medication is right for your particular needs. Weighing the benefits and risks. Both Advil and Tylenol offer valuable benefits for managing pain and fever, but like all medications, they also come with potential risks and side effects. Ibuprofen, with its potent anti-inflammatory action, excels in reducing pain caused by inflammation, such as that associated with arthritis, sprains, and menstrual cramps. Its effects tend to last longer than acetaminophen, providing sustained relief. However, ibuprofen's impact on prostaglandins, while beneficial for reducing inflammation, can also lead to gastrointestinal side effects. Prostaglandins play a role in protecting the stomach lining, and inhibiting their production can increase the risk of heartburn, indigestion, ulcers, and even bleeding in some individuals. Acetaminophen, on the other hand, is generally considered gentler on the stomach and less likely to cause gastrointestinal issues. This makes it a preferred option for individuals with sensitive stomachs, a history of ulcers, or those taking blood thinners. Acetaminophen is also often the go-to choice for fever reduction in children, as it's generally considered safe and effective for this purpose. However, it's crucial to be aware of acetaminophen's potential for liver damage, especially when taken in high doses or for extended periods. The liver is responsible for metabolizing acetaminophen, and exceeding the recommended dosage can put undue stress on this vital organ. It's critical to follow dosage instructions carefully and consult with your doctor if you have any concerns about liver health. In essence, choosing between Advil and Tylenol often involves weighing the benefits of pain relief and fever reduction against the potential risks associated with each medication. Factors such as the type and severity of pain, individual medical history, and potential for side effects should all be considered when making this decision.